name is Shandabi Coleman, and I am going to talk with you today and try to educate you all about sexual transmitted infections. An STI is an infection. It's passed from one person to another through sexual contact. An infection is a bacteria, a virus, or a parasite that enters and grows in or on your body. STIs are also called sexually transmitted diseases, or STDs. Some STIs can be cured and some STIs cannot be cured. And for those that can be cured, there are medicines to help manage the symptoms. Nearly 20 million people in the United States get an STI each year. These infections affect women and men of all backgrounds and economic levels. But half or all new infections are among young people that are 15 to 24 year olds. STIs are spread in the following way: having unprotected sex without a condom, vaginal, oral, or anal sex with someone who has had an STI. It can be difficult to tell if someone has an STI. They are often spread even if there are no signs or symptoms. During genital touching, it is possible to get some STIs such as syphilis and herpes without having sex at all. Through sexual contact between women who have sex with other women and men who have sex with other men as well. From a pregnant or breastfeeding woman to her baby. Through sexual contact between men who have sex only with other men. Vaginal intercourse, oral sex, and anal sex. The first STI I want to speak with you all today about is chlamydia. This is a picture of chlamydia that you actually will see under the microscope. It is the most common STD in the United States. It is also easily curable. Chlamydia treatment usually consists of a single dose antibiotic. About 50% of men and 70% of women don't have any symptoms for years, if at all. When symptoms appear, people often suffer from abnormal vaginal discharge and vaginal bleeding, discharge from the tip of the penis, and pain when peeing or during sex. When left untreated, chlamydia can lead to infertility in women and in men. When you're infected with chlamydia, other STDs may also be present. The next STI we're going to talk about is gonorrhea. This is a picture of it with the infection around the person's mouth. Gonorrhea is often caught alongside chlamydia. About 1 in 3 women infected with gonorrhea also has chlamydia. The bacteria that causes gonorrhea need to be inside the human body to actually survive. For this reason, you can only catch it through sexual activity and not through contact with objects or swimming. The symptoms of gonorrhea include the same irregular discharge as the one used by chlamydia, from the vagina or from the penis. As with chlamydia, many infected patients won't develop any symptoms, even though the infection can cause damage to the women's reproductive system in the long run. Men, however, sometimes suffer from infections. They will have it in the urinary tract and associated symptoms when infected with chlamydia. Painful urination and discharge from the penis. If untreated, the bacteria can spread to the rest of the body, often infecting skin or muscle joints. Gonorrhea treatment normally involves a course of the antibiotic cefiximine. The next one we're going to talk about is genital herpes. Here's a picture of the genital herpes on the person's skin. They kind of look like little blisters. Over 80% of people who are affected with genital herpes don't know that they even have the virus. Most of them will never find out. It's quite common for patients to live a lifetime without even knowing about their infection or suffering from any symptoms. However, they can pass the virus to another partner who can develop the symptoms asymptomatic. Asymptomatic patients tend not to use protection, condoms, every time they have sex, unlike patients who know they have herpes. Genital herpes is caused by the herpes simplex virus. The symptoms are soreness of the infected area and painful blisters around the genitals. Most people are able to recognize recurrent episodes due to the itching and tingling sensation in the genitals that they feel a few hours before the blisters appear. This is the best time to start an antiviral treatment right before the virus starts producing genital herpes blisters. In general, the first herpes outbreak is the most severe one and lasts much longer than any episode that follows, up to 2 to 3 weeks over time. Outbreaks of genital herpes tend to get milder. The next STI we'll talk about is genital warts, which are these in the picture that kind of looks like a blister, maybe a little bit bigger, and they're kind of raised from the skin. Genital warts, also known as anogenital warts, are located in or around the anus and genital area. They're caused by human papillomavirus, which is HPV, which often doesn't cause any symptoms at all and sometimes shows only years after infection. Genital warts appear as little bumps that sometimes form clusters with cauliflower shape. Since they come in different sizes, treatment ranges from antiviral creams, Warticon, to surgery or laser cryosurgery, which is freezing and surgically removing. While they are not dangerous, they are easily transmitted and require immediate treatment. As far as symptoms go, genital warts are sometimes itchy, and in rare cases they can be painful. Women can suffer from irregular vaginal bleeding and or discharge. The next STI we're going to talk about is syphilis, which is the picture that's low down on the board, and it kind of looks like maybe a blistering rash and is red in color. Syphilis is one of the oldest infections on the list of STDs. While nowadays syphilis is fairly easy to treat with antibiotics, if left untreated, the infection can cause severe symptoms. Contagious ulcers on the genitals, the anus, and the mouth. Then infection of the brain, the eyes, and the ears, and is potentially life-threatening. In the early stages, like many types of STDs, the symptoms of syphilis are hard to recognize, and it can take several months before they appear. However, as soon as the bacteria enters the body, the illness progresses in 3 stages, with the symptoms getting worse at each stage. The next STI we're going to talk about is the hepatitis B. It is a virus that attacks the liver like hepatitis C and is passed through sexual contact and blood via needles. The symptoms of hepatitis B start with a short acute infection to which everyone responds differently. A few will develop chronic hepatitis B and others will develop liver severe dysfunction. The majority of people actually develop their own antibodies against the virus and are protected from further infections, yet 5 in 100 people who are infected will suffer from serious consequences from the virus. The hepatitis A and C can also be passed on through sexual activity, but it remains quite rare, so we won't include them in the list of STDs. If you have had unprotected sex and may need to go to the clinic and get tested for hepatitis. This is chronic hepatitis, where the liver is actually swollen, inflamed, and then it'll turn into liver cirrhosis, as you see here. And then liver cirrhosis, if still left untreated, will turn into liver cancer. The next STD we're going to talk about is human immunodeficiency virus, which is HIV, which turns into AIDS. And here is a picture of the virus mutating the cells. It is caused by a virus that attacks your immune system. Basically, you don't die from HIV, but from any benign infection that the body can't cope with. This is the final stage where HIV results in your body to suffer from AIDS, which is the acquired immunodeficiency syndrome. Means basically your immune system will be down. Like hepatitis B, HIV can be transmitted through blood exchange, for example, sharing needles or sex. It can also be transmitted to the newborn by a pregnant woman. And like hepatitis B and other types of STDs, the first symptoms are difficult to recognize as they can feel like the flu, with muscle pain, sore throat, sometimes in combination with vomiting and diarrhea. This fever tends to develop within 2 to 4 weeks after the virus has entered the body, but it can sometimes take several months. Most patients will only suffer from AIDS about 10 years later as they start losing weight and suffering from uncommon infections and cancers. Sexually active women aged 15 to 24 years are at particular risk of sexually transmitted infections like HIV. There are 37 million people in the United States that are HIV positive. 2.6 million in the United States are under 15. 1.2 million people died in 2014. And 5,600 people contracts HIV virus every day. HIV/AIDS isn't just a threat in developing countries. HIV/AIDS is a very real issue around the world. There are many infections that are often misunderstood as STDs, such as urethritis, which is simply an infection of the urethra, part of the urinary tract. Crabs, which is really pubic lice, is another example, which is neither an infection nor a disease, but just tiny bugs, lice, that settle in your pubic hair to lay their eggs and reproduce. They are transmitted during intimate contact between two pubic areas. Many people don't have any symptoms, but some do. Some suffer from itchy genitalia and inflammation. You can only get rid of them with special treatment for lice, like shampoos, lotions, and cream. And this is what they actually look like. The next thing we're going to talk about is trichomonias. Trichomonias is a germ-causing and benign infection known as trichomonasis. It is a treatable infection which is cured with a simple course of antibiotics. The symptoms it causes are common STDs, namely an abnormal discharge from the genitals and pain when urinating or when having sex. And that's the actual disease right there. If you were to look up under a microscope, that's what it would look like. The symptoms it causes are common STD symptoms, namely an abnormal discharge from the genitals and pain when urinating or when having sex. There is also a whole range of infections that are sometimes considered to be STDs, but they are not strictly speaking STDs. Although they are sometimes transmitted during sex, they may be genital infections that are aggravated by sexual activity. These STD infections are easily curable and include bacterial vaginosis, which is a smelly discharge in women, water warts caused by a virus which leads to liquid-filled warts around the genitals, These warts are relatively contagious and can be transmitted by skin contact and exchanging towels and clothes. The advantage of broad spectrum antibiotics such as azithromycin is that while they are specifically prescribed for certain type of STDs, chlamydia, they can also be used to treat other STDs related infections. By getting tested and treated, you can sometimes cure many type of STDs at the same time. So, wrap it up, America.